Hi everyone. Today I wanted to go over a super special and important topic, which is autoimmune disease and pregnancy. So I wanted to go over some of the things that we can do before pregnancy and of course during our pregnancy to ensure having a healthy baby and of course a healthy mom. So before getting pregnant, it's always a good idea to bring up to your rheumatologist that you're planning a pregnancy if possible, so that you can discuss certain things that you can do with regard to your chronic medical condition, whether it be lupus or rheumatoid arthritis or Sjogren's, or if it is just a chronic disease such as diabetes, any condition that it might be, you always want to discuss with your rheumatologist beforehand. Many times they might recommend that you see high-risk OB beforehand as well. So certain things that we do when we find out that you're planning a pregnancy is wanting to make sure that your labs are checked. Here we're checking for clotting markers. A lot of times I check an antiphospholipid panel because we want to make sure there's no elevation of clotting markers, because if there is, then we might be considering you being on aspirin or a blood thinner during your pregnancy. Another thing that we check for is Sjogren's antibodies, the SSA and SSB, and we sometimes see that in our rheumatoid patients, our Sjogren's patients, our mixed connective tissue disease patients, and lupus patients. So that can sometimes cause a fetal issue with arrhythmia. Then we want to follow that quite closely, where you would get a fetal ultrasound. Although it's quite rare, it is something that's recommended if you do have that Sjogren's antibody, and something that we follow closely. In addition to that, it can be really protective to be on hydroxychloroquine during your pregnancy, and it can be highly recommended in some of our patients with connective tissue disease problems, and it is very safe. In fact, it's protective for your baby against having those kind of arrhythmia problems. It can protect against that. So that's something to keep in mind and to discuss with your rheumatologist. Other things is to make sure you're not on certain medications if you're planning a pregnancy, because some of them are just not compatible with the healthy pregnancy. So some are methotrexate, Cellcept, luflanomide. These are things that we would want to talk to the rheumatologist beforehand, because we would want to try to change things if possible. So once we're able to hopefully have you on a regimen that's safe, we also want your disease to be as quiet as possible when you're trying to conceive. So the longer that you're in remission, hopefully that will also be planting the seed for like a healthy long pregnancy, and not putting you at risk